Good afternoon, ladies and gentlemen. First of all, I must thank the organizers, Elets Techno Media Private Limited, for inviting me for this 6th Summit on Health Leadership Forum. It's my pleasure to be here because I consider it good to interact with people from different forums, different areas, from health professionals, IT professionals, health service providers. Because I and the ministry would believe that it's always good to interact and have also feedback, and also we should be sharing as to what we have been doing or we would be planning to do in near future, and also in terms of long-term strategy and planning in the field of healthcare. I was told, and I would focus primarily on the eHealth aspect. I, as Joint Secretary, look after Prime Minister Swasthya Suraksha Yojana, which is in fact a flagship program of Government of India for taking tertiary care facilities to nooks and corners, to different places in the country, to remove regional imbalances in the tertiary health care. But that is not the topic that I cover today, because I also look after the e-governance initiatives in the Ministry of Health, that is the eHealth initiatives. So I'll be primarily talking on those aspects. And given that Government of India is doing a lot on large-scale ICT initiatives as are in progress and have been envisaged, aligning them with Digital India program and eHealth plan of Government of India. So it's quite an opportune time that I will share with you what we have been doing and some kind of deliberation, feedback, some kind of questions that may be there. So both myself and the August gathering, the people here in the August gathering would certainly, we look forward to interacting and gaining from that. ICT having gained an increasing role as key enabler of healthcare systems to improve access to health services, quality and standards of care, and health system productivity. It'll be certainly good to talk about, and I'm sure quite a lot is being done in the private sector, in whether it is insurance sector or whether it is health service providers, major hospitals, hospital chains, and so on. I would share with you at this time that in 2010, an OECD, that's Organization for Economic Cooperation and Development survey of the countries, had identified 4 core objectives of ICT implementation. One, it was to increase the quality and efficiency of care. Second, to reduce the operating cost of clinical services. Third was reduce administrative cost of running healthcare system. And fourth, enable entirely new models of healthcare delivery. Now, for example, if we talk of electronic health records, of which a lot of talks have been going on in the country, it would certainly help in providing continuity of care and also much better help to the people who, to the common people who have to avail the services, health services, in as much as that if we talk of EHR, if it is available electronically, if it in an interoperable mode across hospitals and maybe across countries. A lot of people come from abroad here for treatment, so they may not have to simply bring with them their health records, that we should be able to electronically obtain and have a look at those. Those kind of systems where continuity of care is maintained. For example, in public health in India, so many initiatives separately have been going on. We have like mother and child care system, where much before starting from the pregnancy, a lot of healthcare kind of healthcare provisions have been made, whether it is in terms of vaccination, whether in terms of some usual normal medical checkups, and then post-pregnancy, all those, whatever has been provided to vast masses in India, to the pregnant ladies in India, if that is available on electronic records, which can be seen 10 years from now, a continuity of care would be feasible. Similarly, if an accident takes place and a particular person, injured person, ends up in the hospital and is not in his senses, then if one can access his records electronically, that's a very great proposition. I mean, that's a kind of vision we could be looking at. Third, this is about the individuals. If we talk of at, let's say, at policy making level, if all the health care data gets accumulated and becomes available to the policy makers, that's a very great proposition in the sense that your policy intervention can be very, very focused and directed. So, talking of electronic health records, this would be my main focus today, because I would believe in the morning session, Mr. Jhalani would have, who was Joint Secretary for Ministry of Health, he would have spoken about the different initiatives. Also, in the field of eHealth that is being taken under the National Health Mission. So I may not be talking much about that, but I would like to focus on the electronic health records. The ministry is very seriously looking and considering how to bring about electronic health record system in the country. For this purpose, one very basic thing is, of course, core computerization of a health unit. It could be a district hospital. If I talk of government sector, it could be a district hospital, it could be a community health center, a level below, it could be primary health center, it could be a medical college, it could be a institute of national importance like All India Institute of Medical Sciences, or maybe medical colleges across the country which are in government sector. So talking of government sector, one needs to take care of computerization of the core functions, which would mean diagnostics, which would mean treatment, laboratory test results, and also the medicines which are prescribed to patients. Those should also have to get captured in the through a hospital management information system. So starting from there as a first building block, then next would come national level electronic exchange, what we would call is integrated health information platform. That platform will be one which would help in interoperability of the data from different hospitals. Let's say if somebody comes from treatment from district hospital to a medical college, or a medical college to, let's say, to AIMS. So his medical history, what we call electronic health records, should be available readily to the hospital, to the AIMS Delhi, or to any medical college where he goes. So that for doing that, we need to build up a right kind of ecosystem, and it has to be a collaborative effort with all stakeholders, all players to come forward and move. For example, the government has to create ecosystem. The ecosystem that the government visualizes to create has several dimensions. One dimension is that for any computerization which should apply is that we have to have standardization. So standardization on two fronts. One is the terminology that is used for health records, which would be terminology that you use for diagnostic, for medical equipments, terminology that we use for classifying of diseases the way it is prescribed, and also terminology that is used for prescription, that is medicines. So terminology have to be standardized, the directories have to be created. In this direction, already electronic health record standards have been notified in 2013 itself, when the government of India was toying with this idea initially. Since 2013, because it's a dynamic process, the revisions also going, the first revision is going on now in 2016, where we would be taking care of the new developments and also notify and make available the EHR standards, electronic health record standards, which would cover again those who are more familiar, what we call HL7 for equipments, then there is LOINS for laboratory test results and all, and then there is SNOMED City. SNOMED City is it's an abbreviation for systematized nomenclature of medical and clinical terms. I give a simple example. If you talk of let us say diabetes. So diabetes would have one diabetes, and there would be further classification of diabetes, then there could be some more classification. So there has to be a standard way of for diagnosing and reporting that kind of thing. Then only the collation and then only the transfer in a seamless interoperable manner can take place. So one thing that is being done is the standard for electronic health records that we are working on. Second thing that is being done is that we will be creating a kind of portal through which will also provide as an exchange where this kind of transfer of data would be feasible. Thirdly, even the standards, for example, open API systems have to be adopted. So certain standards have been also been given by the DT, that is the Department of Information Technology, and also some metadata standard that we're making use of. Other things that we are doing is because in health records there has to be uniqueness. Let us say a person by name Sunil Sharma goes to one hospital and he goes to another hospital, to third hospital, to fourth place. Then to be able to bring all his medical history together to make health record, it's essential that Sunil Sharma is recognized by one single unique number. One would think Aadhaar would form that kind of number, so we would like to depend on Aadhaar. Of course, there are issues, Supreme Court had certain observations, but one would hope that Aadhaar would ultimately get accepted as one unique number for every citizen, individual of this country. So that uniqueness about people that we are working on. Second uniqueness that we are looking at is uniqueness of health service providers. So what we are doing is that we are creating an application which will soon be available to all health service providers. And by health service provider, I mean not just hospitals, also pure laboratories, blood bank, any other diagnostic facility. It could also be Ayurvedic, homeopathy, and all kinds of things. So we will provide a unique number which we have named as NIN, National Identification Number. Already in the government sector, we are providing this number to all the government facilities. There are about 1.8 lakhs of those. To private, we will soon be opening up, and I would urge and I would think that in the long run, the service provider facility, health service provider facilities from health sector would also benefit in this exercise in the long run. So as we open up this NIN number, all health service providers can apply on it and obtain a unique number for them, which they can benefit, because later on when the interoperability will come, then those NIN numbers will also be very, very relevant to cull out the data from their particular hospital as may be required. Let's say somebody coming to Apollo hospital, he comes from a district hospital. So the district hospital unique number will help in fetching the data of the patient who would go and treat himself in Apollo hospital. So we are getting that unique number generated. So these are the few of the things that are being worked out to create ecosystem for eHealth record, interoperable eHealth records. Other things in this area that we are doing is about the privacy issue. Health records are very sensitive. The medical fraternity would very well know it when they have their medical education. That's the time it's one of their oath and vow that they would not share that information with any third person. It's to be kept secret. It's a in fiduciary capacity with the doctor. And when this kind of records comes at a mass level in electronic format, in different servers, in different computers, the privacy issue gains all the more importance. So what the ministry is doing is, ministry is has already engaged one premier law institute to frame out a legislation on the privacy issue. While common privacy, of course, there are privacy, what do you call it, if you look at the bottom of any website or anything, there are those observations that about the privacy, that your data is protected and so on. So whatever privacy guidelines already exist with respect to the overall electronic ecosystem which the government of India, the Department of Electronics and Information Technology has provided. Besides that, for health, there will be additional kind of provisions with regard to privacy issue, and we would like to have, we will go for having a legislation so that privacy of data is protected. It is the data is not allowed to be shared unnecessarily. So there would be guidelines like who can share, who can allow, how it is to be handled. Then the person whose data it is, he is the owner. So it is with this permission that sharing will take place. Those kind of issues are going to be there. So privacy issue we are going to address. Then other things that in this field that we are doing it in government sector particularly, we are going for computerization of health facilities up to community health center level, a level below district hospitals. So already NIC, National Informatics Center of under Ministry of Information Technology, DTT, has already developed application which is on cloud for e-hospital. And also there are a lot of state governments, many state governments have gone to private concerns for developing applications. So for computerization of the district hospitals, so for community health centers and so on. So they, the idea is to bring as much health records in the electronic format, so that in the longer run, Sorry, out of time. Okay. Right. So this was broadly about what the electronic health record ecosystem that government is creating, and we would also like to rope in the insurance players, because ultimately what we visualize is that insurance companies have their own pain areas when it comes to getting information about patients. So if the health record is available electronically, their task also becomes simpler. So it will be kind of collaboration where we would expect that insurance companies to insist on following of electronic health record standards by the health service providers, that is hospitals, etc., who are on board with them, who are enrolled with them. So that's the kind of thing that we're building ecosystem, and we look forward to it coming through in years to come. I'm not taking much time. I would thank all of you present here.
Thank you, sir. Thank you, Mr. Sunil Sharma, Joint Secretary of Government of India, Ministry of Health, looking after eHealth and Pradhan Mantri Swasthya Suraksha Yojana. Sir, I'll just request you for a minute to come on stage so that we can present you a memento as a token of appreciation. And I request Dr. Sandeep Namdev Mahatme, he is the District Collector of North Tripura, to please present a memento to respected Joint Secretary, Government of India. And the time is a constraint, otherwise we would love to hear you for so long.